All right. Hey, everybody. Thank you so much for joining us. Um, just in case you didn't see the video on the About page introducing me, my name is Jonathan. I'm a healthcare provider, have a decade experience in the emergency department, um, and also built from the ground up a health and wellness clinic um, with a few locations. And when I say from the ground up, what I mean by that is Um, didn't franchise, dug deep into the research, spoke with specialists because there's a lot out there, um, but honestly, there's a good bit that you get like 5 times your daily dose from your diet, um, even with some of the poorest of diets. So there's a point where um, what topics as far as vitamins and minerals we need to talk about. And I definitely want to focus on the major ones that can change how you feel and are life altering. But probably not going to hone in as much on, the minutia of some of the other ones where you're not going to see as much of the effect there, or you easily get your daily doses from your diet. So this will kick off our first one here, but just to give you background, that was background from, so you have an idea that I have the health and wellness side for preventative and health optimization, and then also experience in the other camp of reactive medicine, very reactive with being in the emergency department. So for this story, as you could tell by the title, today's topic is magnesium. And I had at the time of this recording, we're in the heat of summer at the health and wellness clinic. There's some high schools nearby. Those kids are outside practicing football every day. Player came in recently, drenched in sweat, could look at him, muscles were spasming. I mean, you could just look at him, not even do anything else, and just see the muscle spasming. That had been drinking water all day, drank some sports drinks, but lo and behold, when I go look at it, the only electrolyte that it really tackles is sodium, doesn't really tackle anything else. So when you think muscle spasms, and anyone in this heat, but also particularly with athletes where they're sweating all their electrolytes out, you tend to think magnesium with stuff like that, especially if they've been having their sodium, replenished with this, sports drink. So what is magnesium? By the end of this video, you should know what magnesium is, how to know if you need more of it, where to get it, and what keeps you from getting enough of it. So what is magnesium? It is an essential mineral involved in a ton of processes throughout your body. A trend that I've noticed in the emergency department is more and more people are getting magnesium. Used to be when I first started, it was certain pregnant patients would get it, very carefully monitored by the OBGYNs. And certain dangerous heart rhythms we would give it. But more and more so, we're seeing a lot more people coming in with these spasms, muscle cramps, where people aren't even able to walk. So it's not a huge surprise that during the fact checking found that about 50% of the US population does not get enough magnesium, because we've seen that trend in both the preventative and traditional kind of reactive healthcare settings. What are signs of low magnesium? Like we just talked about, muscle spasms and cramps, fatigue or trouble sleeping, numbness and tingling in extremities, anxiety or irritability, heart palpitations and abnormal heart rhythms, nausea, vomiting, and constipation. So constipation, especially in the emergency department, that usually is something I help people with magnesium. I usually get the magnesium citrate. Usually that does a very good job of getting someone to get their bowel movements going. So that's when you want to get them going, because the next step is Go Lightly, which is the same prep you use for prepping for a colonoscopy. So it gets unpleasant quickly. So, but magnesium helps with getting things going on the constipation side. Osteoporosis, where calcium isn't really helping with bone formations. Your bones, you can see kind of a depletion of calcium, less calcium, less white on an X-ray, which leads to the next point, hypocalcemia, low calcium, which is what led to the osteoporosis above. The next one is hypokalemia, low potassium. So when I have someone come into the emergency department with a low potassium, actually check their magnesium level, because you need magnesium to help potassium get into the cell. So if you have someone coming in with low potassium and you don't check their magnesium and their magnesium is low, you could be pumping a bunch of potassium in them and their level's not really changing all that much. So if you have that, if you have someone with low potassium and low magnesium, optimize the magnesium, get that higher. Usually in a hospital setting, it's going to be through IV magnesium, and then start tackling the potassium, so the potassium can actually get into the cells. Next thing magnesium can help with is diabetes and heart disease, poor memory, headaches, high blood pressure, and in severe cases, seizures and dangerous heart rhythms. So to complement my conversation before, magnesium helps potassium get into the cells, and is a cofactor with helping with that. Magnesium also helps with activating and optimizing vitamin D and vitamin K2, both of which are essential for our overall health. Vitamin D obviously helps with bone growth as well, but can also help with immunity. Vitamin K2 has a ton of benefits too. One of my favorite is what I learned through as I was building the health and wellness optimization clinic, is one of the benefits of vitamin K2 is it can actually loosen and almost kind of liquefy plaque that's in your arterial system. So when you have plaque building up, it can actually help with your overall heart health through getting that plaque off the arterial walls. But it's optimized, maximized with the help of magnesium. Magnesium also helps to complement that statement with cardiovascular health, bone health, muscle health, recovery and function, blood sugar control, mental health, cognitive health, keeping inflammation in check, systemic inflammation, and GI health. With the mental and cognitive health aspect, another really interesting story. Had a client come in my health and wellness clinic. He came in for nausea and vomiting, but he told us at the gate, he's like, I know what's causing this. I struggle with anxiety, really, really anxious. There's a lot going on. We adjusted my medications. It's not really helping as much as I thought I would. I'm super anxious right now. And when I get like this, it helps. Well, it propagates episodes of nausea and vomiting. We have a very fortunate blessing of having an in-house pharmacist at our clinic. So we're able to look at the medications that he was on and what was adjusted, and be able to customize essentially a vitamin infusion drip for him, for which we gave him a little bit higher dose of magnesium to help him calm down. I should clarify, especially if you're someone who goes to these health and wellness clinics, we do not change any of the medications. That is not our role. We basically make sure that what we have in our toolbox for why he was coming in, that we would be able to get him something that would not interact, especially negatively, with anything that he was taking. Magnesium rarely does, but that's an important note that you need to do if you're someone who goes to IV clinics. If you go in and they're starting like, hey, you need to change your medications, that is not the role. You just walk out of that clinic and go find somewhere else that's a good clinic. So we let the specialists continue with their medications, but we were able to say, hey, I think that magnesium, a little bit higher dose of magnesium, is going to help you. By the time that he was done, vomiting completely resolved. He felt a ton better, and he said, man, my anxiety is in a much better spot right now than it was when I first came in. So kind of going back to the point of what we're going to cover with this, what is magnesium? Magnesium is an essential mineral involved in tons of processes in our bodies, and can help us relax and calm down and help soothe us. Ways to test for magnesium levels. You can take a supplement, just kind of, if you are experiencing any of those symptoms that we mentioned earlier. You got headache, fatigue, kind of brain fog, muscle spasms, just try a magnesium supplement, see if that helps. I give it a solid few days or week, see if it helps you any. If that's the case, your magnesium was probably low. You can definitely get a blood test as well, just kind of objectively find out, hey, what's my magnesium level and is it low? And then kind of go from there. And then another step that I took for myself, me personally, was actually we offer at our clinic genetic testing. So I took a genetic test and found out that me personally, I have a genetic tendency to be low in magnesium. So when I checked my blood work of my magnesium level, it was low normal. It was at 2, which in traditional medicine is within normal limits, but knowing that I have a tendency to have low magnesium based on my genetic foundation. Took supplements, got up to 3, really helped with mental focus, clarity, energy, sleep. So there's ways that you can optimize that. And the benefit is, what's really cool is what your body does not use, it just pees out. You just pee out the extra magnesium. In your diet, you can have leafy greens, legumes, nuts, seeds, avocados, bananas. You can also get an IV drip. Supplements, standard supplement drip is 400 milligrams per day. At our IV clinic, that's what we typically do as well, is 400 milligrams through the IV. You do feel that big difference because it's going directly into the bloodstream as opposed to having to digest the 400 milligrams orally. But you could go really either way. It's really, really rare to get in trouble with magnesium. Now, it can happen. So not painting the picture that nothing's impossible. But you got to have really high doses, typically through an IV, like within a short period of time, really high dose of magnesium for it to be a problem. Because even in the emergency department, when we replenish magnesium, it's usually 2 grams of magnesium, which obviously is more than 400 milligrams. As well. So if you're finding yourself somewhere and they're like, hey, we're gonna get your magnesium and we're gonna give you 10 grams of magnesium, just say, no thanks, and walk out. But it is rare and difficult, but definitely possible to overdo it. So but it's really, really hard to do orally, because when you're digesting it with oral supplements, your body usually pees it out before you even have an opportunity for it. So this is Dr. James. Love Dr. James. Love his social media. There's not anything I've ever come across that I have an issue with. It's usually simple, clean, and simple stuff that you can, as soon as you read it, pretty much act on. The main focus of this post from Dr. James, and I'm not even going to try to attempt saying his last name, but much respect to Dr. James. And focus of this one is the different types of magnesium. So magnesium glycinate helps with stress, sleep, blood sugar. Magnesium malate helps with muscle pains and fatigue. Magnesium citrate, night cramps and constipation. This is the one I was referencing when I see patients in the emergency department with constipation. I give them magnesium citrate. Usually comes in a 300 ml bottle. It's really 297 ml. Drink it, and then just kind of be ready. Be near a toilet. That's usually what I tell people, because it can just help hit you all of a sudden. But works pretty well. And magnesium is a natural mineral. And then magnesium threonate helps with cognitive function. So back to our slide about what can help or what can deplete your magnesium. Big things: sugar, coffee, stress, alcohol, too much calcium. How do you get too much calcium? Well, the next slide. Antacids, diuretics, digoxin for irregular heart rhythms, and omeprazole. So all these can make your magnesium levels go down. So if you're feeling any of those symptoms and you're undergoing any of these, which most of us are, especially those first 4, sugar, coffee, stress, and alcohol, those are big contributors to low magnesium. Other reasons: bariatric surgery, celiac disease, cancer, colon removal. And obviously for bariatric surgery and colon removal, absorption issues is a big component of those. Heart failure, hyperthyroidism, kidney disease, liver disease, type 2 diabetes, pregnancy. Got to be real careful with magnesium in pregnancy. Usually that's monitored by an OBGYN if you're getting magnesium during pregnancy. So back to our main topic slides of what you'll learn. So what is magnesium? It is an essential mineral involved in tons of processes in our bodies. Helps us relax and calm down. How do you know if you need it? I'm sorry, what are some foods that you can get it from? Leafy greens, nuts, seeds, legumes, avocados, bananas, you can get from supplements. And then what are things that can deplete your magnesium levels? Like we talked about, the big four in the United States: coffee, sugar, stress, alcohol. And as we mentioned in those other slides, bariatric surgery, celiac disease, chronic kidney disease, type 2 diabetes. So pop quiz, what is magnesium? A, it's a vitamin. B, it's a type of cell. C, it's an amino acid. Or D, it's an essential mineral. And the correct answer is D, it is an essential mineral. How long does magnesium help you? How does magnesium help you? A, it'll make you smarter with brain health. B, it'll help your heart work better with heart health. C, it will help your cramping and inflammation go down. Or D, all of the above and even more. And the correct answer is D. Huge surprise, because it's involved in a lot. What are some good sources of magnesium? A, oatmeal and yogurt. B, leafy greens and avocados. C, chicken and tuna. Or D, oranges and apples. B, leafy greens and avocados. And that's all we got on magnesium. Thank you so much for joining. Keep an eye out for some other stuff we got coming up. Thank you very much. Have a good one.